Welcome to the Vitalis Health series of video blogs, where Dr Siobhan Graham is interviewed by Susan Hughes.
I think we're becoming so aware of bad posture in the workplace, but probably not outside the workplace. For example, driving is a good example. That will protract it. So protract it means sticking out neck posture, and I'm totally guilty of that. And so it's all about just lifting up from the chest, and so lifting up from your sternum here, and you can see the difference already. I'm like vertical as opposed to like this, the head's forward. And so I see it in so many different fields. I'm not sure where to start, but I can start with one example: headaches. So somebody with pain in the temples here can come from really tense sternocleidomastoid muscles. So that's this big muscle either side of the neck that attaches here to the midline, the sternum, and it goes right up here to the corner of your jaw. And so when you're in that forward position, it gets shortened and it becomes really tense. And people get trigger points in them where if you just feel this muscle, you can trace it yourself. So from the corner of your jaw, literally coming down in a V shape to here, and you'll feel that it's tense. I don't know if you can feel that there, particularly in here. And so even just working on getting the neck back, so there's different exercises you can do. Either protracting it and retracting it's a good one. It doesn't look that attractive, but that's good. Strengthening your neck muscles at the back, you know, where you're just pushing against the wall. Best to go to see a physical therapist or physiotherapist for that. So yeah, I see people with headaches originating from that muscle.
Shortening of the muscle and the trigger points, then just the nerve, there's some connection with the nerves that go into the head.
Yeah, so they kind of, I don't know if it's just referral of pain. So a lot of pain in people, human beings, is referred. So people with shoulder pain will get neck pain, they'll get mid-back pain, they'll get pain here when the issue is just in under the shoulder blade. Okay, and it's usually postural as well. So this muscle goes up to here, and then there's another muscle that spans up into here, and people who clench their jaw can get, I saw a guy not that long ago with like swelling of the muscle here on either side. It's from clenching his jaw. So yeah, that's bad posture. Driving, sitting at a desk. So I've got a standing desk now, which is amazing. So in between patients I try to stand doing paperwork. You know,
is it the sitting that is the problem, or is it more the way you sit then?
Yeah, so sitting at a desk has just all kinds of problems inherent to it. So the first one is just so getting up from the chair, but here your bum muscles, I don't know if you can see them here, gluteal muscles, they don't really work when you're sitting. And the minute you sit down, you shorten the the quad muscles here, and you push your hip joint, you push your hip bone in the hip joint just further back, and so people get tightening of the muscles here, and they just get weak. So they get weak bottom muscles, gluteal muscles, and then they're more likely to get back pain, and that kind of just goes up the whole chain. So the chain of command from your core, most people know about their core, but the whole way right up to their neck. So you have to focus on the core. So try and activate your bum muscles if you're sitting down. Try and activate your tummy muscles. Like I was on the swings yesterday at Cherryville Park with one of my daughters, and I realized, oh my goodness, this is really activating my tummy muscles. Like I'm only swinging, but
like pulling
my legs. Yeah. And I realized, gosh, I don't do this, but kids do it every day. You know. Yeah. So setting weak core, weak gluteal muscles, pushing the hip bones further into the socket so that you sometimes get pain at the front of the hip joint. So a lot of women, you know, come in with pain just here at the front of the hip joint, and that's often from those weaker muscles. So strengthening is great, stretching those muscles in between sitting, and then just reducing your sitting time is so important. I think we're all just so much weaker because we sit. No matter how much exercise we do, we're weaker.
So even just the duration of how much we sit is affecting our bodies, let alone if we're slumped or if our neck is forward. That's even on top of. just sitting still, basically.
Yeah, they're
Not being active.
Yeah, there's a saying, you can't outrun a bad diet. So, you know, if you eat rubbish, but yet you're an amazing runner, like you just can't outdo the bad food, but you can't really outdo the sitting. So the sedentary time that we spend, you know, whether it's on the sofa combined with the car, combined with the desk, you know, is around 8 to 10 hours a day. And that has its own independent impact on our health, even if we go out and run an hour in the evening time. So that hour running is amazing, brilliant for the heart and everything, but being sedentary for the rest of the day, we just decondition. Our bones lose their strength. Now, it's not rapid, like I'm being dramatic, but just to give you the big picture, you know, your bones won't be as strong, your muscles, your tendons won't be as strong as well, and that's just the start of it. And obviously all that affects your heart health as well. So
my uncle, who's a viola player, he swears by the Alexander technique. He had serious problems and then he did the Alexander technique and he doesn't have any problems anymore. Do you know anything about that?
Yes, he was from New Zealand, but he was some kind of singer or musician, and he noticed that his voice was strained and depending on the posture that he had. And so he was watching himself in the mirror. Now I might get this totally wrong, but something along these lines, and he realised he was just overusing muscles when he was singing, and so he changed his posture, and it was the same thing, lifting from here, tucking the chin like this, so you have quite a vertical spine, and then his hoarseness or whatever his issue was disappeared. And so it's the overuse of the wrong muscles, it's the stress and strain that we put other muscles on the opposite side that cause most of our problems. So the couple of things while we're on that I took away from that class was getting up from a chair as well. So normally we get up from a chair, I used to like this. So I'm using my shoulders, I'm not really doing anything else, I'm using my arm and shoulders, but his advice was to just lean forward onto your feet and use your weight to get up like that. And so you're activating all of your leg muscles, you're not using any of your upper body muscles.
Say it again, so you
literally, so get up as you would normally get up. Okay, so you're pushing up with your hands, so relax your arms, bend forward, use your body weight to kind of, so it is quite far forward, and then come up. So it's quite a smooth.
You're engaging other parts of your body.
And you're using the momentum, I'm not sure about sitting down, but you're using the momentum of your body created by your weight moving over your centre of gravity to tilt you onto your feet, so you're on your feet, and then you just stand up.
It's a bit like being on the swing as well, using the momentum and the weight.
Really helped with that. So.
Are there any tips you want to give maybe about standing posture?
Yeah, so standing is, most of us stand in a forward position. I hope I'm not preaching to the converted in terms of anyone who's a physio will know this, but if you stand up, Susan, let's do this. I think we're both wearing dresses, which is unfortunate because you can't really see the posture. So most of us stand like this forward. So the feet are kind of almost behind the midline, and really we should be more on our heels. You can't really see our feet. So not swaying forward onto your toes, but just somewhere in the middle, and then knees slightly relaxed, tummy in, tuck. I like to tuck my bottom, but you know, as long as it's not sticking out the other way, tuck it in, and then lift from the chest and just let the arms hang as they would. And the other one is just to almost pinch like an apple here, so that your chin's not tilted up as you lift your chest, and it's not forward, but it's just, I'm looking ahead. So when you're out walking, trying to look at the horizon as opposed to your feet. Mums carrying babies, you know, holding babies on one hip or in front. I mean, I did it as well, and I think that definitely gives you back pain, you know, coupled with the stress of probably having a new baby. So yeah, try and get one of those backpacks, put your baby in your back, or, you know, the tiny babies on your front are fine. It's just when they become heavier and they're on your front, they're just pulling you forward again. So try and get the baby on your back.
Back is better?
Back's definitely better, yeah.
It's easy to change, really, isn't it?
It is easy to
Create a
change. You need somebody reminding you, and you need to check on yourself. Don't feel bad about it. Look in the mirror, and just keep at it. It probably takes about a year, I imagine, to really just fine tune
Establish
it.
a good habit. Thanks, Siobhan.
All right, thanks.